this. Okay, cool. All right, so from there, I like seeing you guys. I got a certification in hyperbaric and became a certified chamber operator. Did a ton of research, read a ton of books, and that's just kind of how my personality is. I just kind of obsess about a specific topic. But anyway, it's pretty cool knowledge I have collected. Anyway, so what is hyperbaric oxygen therapy? So pretty simple, honestly. Hyperbaric oxygen therapy is just pressure and oxygen. So you are receiving oxygen while pressurizing the body at a pressure greater than the atmospheric pressure of sea level. Now, the atmospheric pressure of sea level is 1 ATA, and the pressure that I use in my chambers, it's considered a mild chamber, which I'll go over in a little bit, but that is a pressure of 1.3 ATA. And these chambers can go up to 4.0 ATA and higher. So pressures can get pretty intense. 1.3 ATA is the same pressure as being 11 feet below sea level. So these were first created back in 1664. The first chamber was made back when people were using it to recover from the bends. And that was in order to get the nitrogen back out of the blood. And then they started discovering that scuba divers felt a lot better after they'd go on these really intensive dives. And so they did more research into that. And the first medical experiments started being done on hyperbaric then, with how it can affect the body back in 1800. And it wasn't until 1970 actually that the first medical experiment with it was published, and they found results good enough to publish. And so kind of a crazy time frame there with, you know, when it was first discovered and when experiments have really started taking place. But how all these pressure changes work and how it gets more oxygen into the body is all based on Henry's law, which states that the amount of gas dissolved into a liquid changes with pressure. So with oxygen therapy, by increasing the pressure, you're increasing the amount of dissolved oxygen into the body. It's really as simple as that. And so in this chamber here, it pressurizes to that 1.3 ATA, and you're getting an oxygen concentration diffused into the plasma portion of the blood up to 7 times the normal amount that you would normally have just in regular life, especially up in Breckenridge, where the normal oxygen we're breathing is about 15%. And at sea level, it's about 21%. And then when you're in the chamber here, or in Breckenridge and here in Boulder, you're getting about 35% oxygen inside that chamber. So what's happening with mine specifically is it's being pumped full of air, and then you are being given 100% oxygen through a nasal cannula as well. So everyone's getting a nasal cannula, and then what is not brought into the lungs via that cannula is being diffused into the chamber. And so that chamber then fills up to 35% oxygen while in there. So, and then when that oxygen is getting to the plasma, it is able to reach all tissues of the body, which is normally harder to do. So pretty cool stuff. You're also decreasing all inflammation in the body and swelling. You are creating new nerve cells. You're creating new blood vessels, releasing your body's own stem cells, increasing circulation everywhere, along with cerebral blood flow as well to the brain. Tons of antibacterial benefits as well as anti-aging benefits as well. So pretty cool stuff that's happening inside the chamber. And then, so the types of the hyperbaric chambers, which I touched on a little bit, but there are different ones. There's soft chambers and hard chambers. So these soft chambers are ones that are not as well studied as the hard chambers. That is specifically because hard chambers are in more hospital settings and clinic settings, and they were the first ones ever experimented on and have the money and the assets to actually do those experiments with. The soft chambers are considered portable chambers, and they are used more so at people's home settings and small clinic settings like myself. And so these harder chambers, they start at 2.0 ATA, which is about 33 feet below sea level, and go all the way up. Some reach up to like 100 feet plus below sea level. Those are going to be used for really, did I talk about that yet? Those are going to be used for some really intensive wound healing, and we'll get more into that a little bit in a sec, but soft chambers are going to be more so for acute and chronic injuries and all kinds of different conditions that I'll touch on more in a sec as well. All right, so this is just a couple pictures. You can see the difference of the hard chambers versus the soft chambers. So hard chamber to the left, that's what you're going to see more so in the hospital settings. And then soft chamber here is what I have. And the chamber I have specifically is made by OxyHealth. It's called a Viteris 320, and it is the most trusted brand for these at-home use / small clinic chambers. All right, so going over what a session actually looks like when somebody comes to me. You can wear whatever you want. The chamber gets a little bit warmer as it goes on, so I recommend people wear layers. As you're getting to pressure, that takes about 10 minutes. And so during that time, people's ears, you should be clearing your ears pretty consistently through that time. People feel that pressure in their ears. And so when you feel that pressure, do whatever you need to do to pop them. So, you know, plug your nose, blow out, or just wiggle your jaw or yawn or swallow, however that works. During that time, I check in with people in the little window here. You can kind of see right there. Check in with people at that window and just make sure that their ears are clearing okay. And generally everyone does really well. I take everyone up and down super, super slow. And so if anyone does have issues, we have communication set in place that we do. And so if someone's having pain or their ear is not popping, that's what we don't want. Nothing terrible is going to happen. You can't like burst your eardrum at this amount of pressure, but it does feel uncomfortable. So if someone is having pain, I just let them know, or let them have me know. I will let them bring them up a little bit. We'll let the ears clear, and then I'll bring them back down. And that's generally all it takes. So pretty simple process. And like I said, takes about 10 minutes. Once they get to that pressure, they're there for the course of an hour. And then bringing them back up from pressure takes about 5 minutes, and a little bit nicer on the ears coming back up. But the ultimate question is always, how many sessions do I need? And this is a tough question because it's definitely dependent on what you're using it for, which we'll get into those uses as well. But there's a book, really awesome book, I highly recommend. It's called The Oxygen Revolution, and it goes over the conditions that hyperbaric can help with, specifically these 1.3 to 1.5 chambers, and talks a ton about TBI, stroke, concussion, PTSD, anxiety, depression, just kind of more so brain-related areas of focus, but it also touches on a whole range of other conditions, like up to 20 conditions. This book goes into details, studies with, and documentations with, which is pretty cool. But anyway, this book says that after 25 to 35 sessions, all of the body's tissues are permanently changed. So this is a really cool fact to know, and kind of what I have people keep in mind when they are using the sessions. And if someone were to come to me with like altitude sickness, it's generally going to be one session and they're feeling a whole lot better. If somebody comes to me and they're like, hey, I want to use some, pre-surgery and post-surgery, I'll have them do like 3 to 5 sessions before surgery and about 5 to 10 sessions after surgery. Somebody coming to me with a TBI, a bad concussion, I'll generally have them do 10 sessions and then reassess after every set of 10 sessions. Normally a concussion TBI is going to be somewhere up to 40 sessions though, or more. But yeah, so every condition is a little bit different, totally dependent on what people are using it for. I have a couple people using it right now for mold detoxification, and that's along the same lines as the brain injury slash a lot of brain damage is happening with mold toxicity. So same thing, they start with about 10 sessions, and then from that we'll reassess. And people can either reassess with their doctors, or they can reassess with myself and just talk about what changes they've seen, what I would recommend, and then they can always talk with their doctor as well, physical therapist, anyone else medically that they trust, and to see, you know, if they would recommend more sessions for them to use as well. But generally, the more sessions, the better. And the closer you can use those sessions, the better as well. So somebody that is coming in with a brain injury, if we can get them in every single day, that is ideal. Somebody who's coming pre and post-op, if we can get them in every one of those days, more ideal. Somebody that's using it just for like general well-being or like post-exercise recovery, they're going to be using it, you know, after that recovery session or for that recovery session, or they're going to be using it like once a week, something like that, just as like a general well maintenance for the body. So everything's a little bit different. Any after effects people have? Generally, not a ton. People report that they feel a sense of relaxation, which makes sense because the chamber also activates your parasympathetic nervous system. So while you're in there, you're going to have a nice sense of relaxation. Cortisol levels are going to be decreased, heart rate decreases, breathing decreases. So I tell people to take nice deep breaths through their nose and out through their mouth to get the most benefits out of that oxygen cannula as well. People generally report sleeping a little bit better and having more energy the next day. I've never had anyone have any negative side effects after using it. The only thing people have reported is ears continuing to pop for a couple days after, or having more like detoxification effects happening to their body. So maybe using the bathroom a little bit more than normal. Head maybe feeling a little bit fuzzy if you're using it for detoxification effects specifically. So like mold and or brain injuries, things like that, might be feeling a little bit fuzzy. Some symptoms might be aggravated for a little bit afterwards. All right, so going back into the treatments, which I've touched a little bit on, but the hard chambers, FDA approval versus off-label treatments for the soft chambers. So FDA has approved hard chamber for a certain amount of conditions, and those are located on the left here. So decompression sickness, or the BENS, anemia, burns, carbon monoxide poisoning, sudden hearing loss, severe bone or skin infections, poor tissue blood flow, radiation injury, and vision loss. So these are pretty intensive medical purposes to be using these hard chambers. The cons to using these hard chambers is, one is that they're very expensive. There is insurance coverage for some conditions that follow along these FDA approved conditions, but not every insurance company is going to approve you for them. And they have to follow a level of injury that is severe enough for them to accept you to use the chamber for those and get the medical approval. So people with like full body, really bad burns can get insurance coverage. But people with, you know, a minor burn on one area of their body type of thing might not get that approval. So, and then knowing that at hospital settings specifically, if you're going to be using it at a hospital, you can be spending up to $1,000 a session to use it, which is just outrageous and not accessible to the majority of the population. So that's something to keep in mind. There are harder chambers at private clinics as well. Those can sometimes take medical insurance as well, but you're going to have a less likely chance of getting the approval through, if it's not through a hospital setting. You're also going to be spending still a large amount of money, definitely not as much as a hospital setting, but still up to $300 plus for a single session. And all sessions usually last an hour to an hour and a half long. So the soft chamber then is really awesome because it's an affordable way for people to get these benefits, but not needing the intensive oxygen and pressurized environment that those hard chambers have. And the soft chamber off-label treatments have been shown to help with all of the conditions listed on the right here. The only downside is that certain conditions may need more sessions than what you would be using at a hard chamber. So let's say you had a pretty bad burn to your arm and you wanted to do some healing. You were denied insurance coverage at a hard chamber, and so you want to use a soft chamber. You might have to use, 20 sessions to get the same results that you might get in 10 sessions at a hard chamber. But you might be spending $1,000 versus mine, which is $67 a treatment. So that's just the main difference in that. It'll end in 10 minutes. Okay. So yeah, just being aware of that. And I'm always very open with telling people that if they come into me specifically with wound healing, I say, yeah, great, you can use it and you will get benefits, but you could get more benefits at a harder chamber if you can find one that's affordable and you'd like to use. And 9 times out of 10, people just end up using me because it's convenient, it's affordable, and it's still going to help them. So with that being said, the only thing that is FDA approved for these soft chambers is the use for altitude sickness. All right. All right, so specifically hyperbaric in the brain. They have found that these 1.3 to 1.5 chambers is the perfect pressure for the brain. They have been finding more than not that less is more. And that has been shown specifically in studies that have been done more recently on these 1.3 and 1.5 chambers. They're finally starting to do more studies with these lower pressure chambers on benefits to all of the conditions listed on the past slide, which is pretty cool that they're finding, that less is more. Everyone thinks more, but these, higher, deeper chambers do have a lot of risks in place, which I guess I didn't touch on, but the higher risk that is involved with those is that way more likely for oxygen toxicity, way more likely to have long-term damage to the inner ear as well as you're getting to those deeper pressures, as well as risk for people with certain conditions and health conditions. So there's a bigger range of people that aren't allowed to use the deeper chamber than those who are allowed to use the more mild chambers as well. So back to the brain, less is more. And the studies that they have been doing have found that there is an immediate increase in cerebral blood flow to the brain that actually lasts after treatment subside for up to 2 weeks post-treatment, which is pretty cool. So you're getting that increased blood flow, that increased oxygenated blood flow to the brain and healing even post-session, which is really cool. Neurogenesis taking place, you're creating new neurons while you're in there, creating new blood vessels as well, repairing any damaged brain tissue, and removing amyloid plaque deposits, which they have found is the leading cause for Alzheimer's disease, are these plaque deposits. And you're also preventing the creation of new ones as well. So one of the studies I'll talk about in a second here goes into detail about how people should be getting into these chambers. The younger, the better. if you can start the prevention of these plaque deposits building up, you can actually prevent Alzheimer's dementia from forming, which was kind of this breakthrough study that just happened like last month, I believe, 2 months ago. This study came out. So really cool findings. And they did that study with a 2.0 chamber. But yeah, similar benefits and all that, which is cool. So outcomes, they found overall increased mood, increased memory, concentration, motor function, sleep, decreased disorientation of people, depression, anxiety, irritability, all of the things. So some of the studies, this is 2 studies on Alzheimer's. 2019 study. This one used just one person, but she was actually diagnosed with Alzheimer's, had kind of rapid cognitive decline for over 5 years. And she ended up doing 40 sessions in 66 days, 50-minute sessions at 1.15 ATA. So even lower pressure, or not as deep pressure as my chamber, the 1.3. She showed improvement in memory, sleep, appetite, concentration, conversation, ability to use a computer. She reported no more anxiety, decreased depression, increased energy, better mood, and increased motor speed. And so as you can see this, I'll read this quote to you though, which is pretty cool. It said that we demonstrated the largest improvement in brain metabolism of any therapy for Alzheimer's disease. HBOT in patient may be the first treatment not only to halt, but temporarily reverse disease progression in Alzheimer's disease. And so that was reported in an article that came out about this study by this Dr. Paul Harch. Next
Carly, sorry to interrupt. We have about a little less than 5 minutes. Can you see the running meeting time at the top of your screen?
Yes, yeah.
Okay, so then everyone, when we get closer, we can just sign into the same exact meeting link, and Carly, I'll make you host again, and hopefully we'll have a seamless transition. Cool. So just to warn you, so Carly, if you don't mind just saying, okay, we'll all sign off now, and yeah.
Awesome, yeah, can do. Thank you for that. Cool. All right. So this next one, this is the one I was talking about on the last slide, this very new study that came out, which has been a really cool study because the quote at the bottom there says, hyperbaric therapy given at a young age is likely to prevent this severe disease entirely. This is really, really cool data and giving people a ton of hope in Alzheimer's and what we can be doing for prevention. But basically what is happening is that this increased cerebral blood flow, for one, is giving that oxygen to the body, to the brain, and also decreasing those amyloid plaque buildups and preventing the new ones from forming. So lots of benefits and what people reported in those, as well as just kind of reversal of their cognitive decline symptoms. And this one was done on the 2.0. First they did it on mice, and then they did it on human participants. And so they only did it with 6 people. And so hoping that after this study, they will start doing it on more people is the hope. All right, next one goes more into TBI concussion-based studies. So this was a 2011 study done on military personnel from blast-induced concussions. So they did 40 sessions, 30 days at 60 minutes at the 1.5 ATA, these mild chambers. These reports were really cool to see as well. The reporting and reduction of headaches, 65% were able to get off medications. A lot of those medications were for their mental health medications, 40% improvement in cognitive functions, and then the related cognitive improvements from there. So physical exam changes, the post-concussion syndrome symptoms, their perceived quality of life, anxiety, depression, suicidal ideations. PTSD has actually shown to decrease a ton in military personnel, as well as the general public with PTSD symptoms as well. Memory, working memory, attention, their IQ score, the SPECT brain blood flow imaging showing the increased blood flow as well. And another study here, post-concussion syndrome. This is a cool one because this shows the effects of it years after an injury. So really cool thing about hyperbaric is that you don't have to have just had a concussion. You can be using it years and years, years and years and years after. Sorry, light timers. Years and years after and still be getting the same benefits, which is pretty cool. And this one as well was done with a 1.5 mild chamber with 56 concussion patients. And again, improvements in all of the related fields of concussion symptoms. And we have less than 1 minute.
Perfect timing. So let's all leave this meeting and then we'll hop on again on the same link. Thank you everyone for being patient.
All right, cool. So just one other study I wanted to touch on here was about TBI and PTSD in firefighters. So this one touched more on the PTSD effects as well, which was cool to see that increase in the mental health field of it all. And this was done on a 1.3 specific chamber. 20 firefighters, 20 sessions, 20 days for only 45 minutes. So pretty low amount of sessions as well compared to the other ones, and still finding pretty amazing, significant results as well. And this is a list of studies right here, this communityhyperbaric.com. They have a ton of studies on there if you want to look at studies for all different conditions. So pretty much every condition that I talked about on the last slide over here, everything on the right there are studies for all those conditions at this website, which is pretty cool. So take a look at that if interested in some more. And also just anything you're interested in, you can just be looking up studies on it. And generally there are a study for it with hyperbaric. All right, so getting into some success stories that I've had already with clients. And so first one is a client, Allie. She suffered from multiple concussions and a pretty serious TBI, and then had a concussion again. So her quote here is, "I have been dizzy for 20 months from a bad ski accident. I broke my helmet from the front to the back and suffered a terrible concussion. I have been bedridden, house-ridden, and difficult walking across the room. I started 4 months ago, 2 sessions a week. I feel it is a critical piece to my treatment as I'm finally feeling better." So Allie was coming in, about two times a week for a pretty long time. She ended up using it for about 5 months with me. But reported pretty significant improvements and got to the point where she wasn't having vertigo anymore and was able to get more back to her life. So I haven't seen her since. Jim and Mary Jo, they were both prescribed 10 sessions each for their sudden hearing loss from their doctor. And so they came to me with complete sudden hearing loss in one ear, and were given a steroid injection from their doctor and then prescribed 10 sessions. And both of them reported they had a hearing test with their audiologist after 7 sessions and reported significant increase in their hearing just after 7 sessions. So they were prescribed 10 more sessions to do with me each, and same, haven't seen either of them again since. Their hearing came back to pretty full capacity. That one was just like shocking to me. I was like, wow, amazing.
Carly, do you think that could work like years after something?
That is a good question. I know that the sudden hearing loss specifically was an inflammation in the inner ear. So they were told by their doctor to get that steroid injection pretty soon after they had it. Jim had not done his for about, I think he said 4 months. He had the hearing loss, and then he finally went in for an injection, whereas Mary Jo did hers directly afterwards. So she went in right away. Mary Jo is also younger and Jim was much older, and their results were the exact same. So I would say, absolutely worth a shot.
Okay, thanks.
Yeah, thanks. Eldridge came in. He actually came in for altitude sickness, and he then after told me, he's like, I have peripheral neuropathy, which was on his form, but he said, quote, I don't know the last time I didn't have pain in my feet, which was really cool. He was just blown away and just so happy to not have that pain. And so that was really cool to see how the pain could be reduced as well, but just with the neuropathy and that increased circulation and blood flow as well, and how much it was helping. Next one was an altitude sickness one. And so this is altitude sickness can help people with one session. I've had multiple people call me a quote God before, which is pretty funny, but this person in particular came in and they did it. They did it one session, and he was getting these really intense migraines. They had been there for a couple weeks already, and he was getting migraines every day that were 3 to 4 times a week that were really debilitating for him, and they weren't able to do anything that day. And came in once, and yeah, his daughter is this person named Leah, and she called me afterwards and said, thank you so much. He hasn't had these migraines the whole trip now, and we're actually able to go out and ski and have a good time. So that was really cool to see as well. Sherry here has been struggling with post-COVID long hauler symptoms, and she was suffering for it, in this quote here, for 8 months. And it was the past, let's see, she stopped using it 2 months ago now, and is totally back to, not totally back, but much better, back to her normal life. Before, she wasn't able to work. She had to take time off work. She couldn't look at a computer. She was having a lot of brain injury type symptoms with it. So all of her symptoms were cognitive and physical in her body. She has 2 kids, was sleeping in, couldn't get up to hang out with her kids. Missing a lot of work, was unable to be going on bike rides, things like that. Be able to go skiing. She just had crazy exercise intolerance as well, and started using the chamber about 2 to 3 times a week, and probably did up to 30 sessions with me, and has gotten her life back. So, and swears for it for the COVID long haulers. So next one, Chris, he's been using it for spinal cord injury. He is a incomplete spinal cord injury, quadriplegic, and he swears by it for a critical part of his recovery. He's been doing stem cell injections at Mayo Clinic, and coming back afterwards and doing the chamber. And he uses it, he uses the chamber twice a week, and has been doing it for probably 3 months now. And he has actually told me he's had brief moments inside the chamber where he can feel his legs, where he's never had that before, which was like, gives me goosebumps. I'm like, what? Rich, he comes in peripheral neuropathy as well. He has some pretty intensive wounds from his neuropathy on his legs, and so specifically trying to use it for the wound healing. He also has very intensive glaucoma, so is pretty much completely blind, can see some shapes and images, but that's about it. And then suffers with some pretty intense depression as well along with that. And his wife actually called me a couple days ago, and she said, it's been so long since I've seen him this good, which also just kind of made me tear up because they've become really, really great friends of mine. And they actually live in Vail and come up from Vail once a week to help Rich in the chamber. And there is a chamber in Edwards, but they choose to use mine because they say I'm a nicer person and the chamber is bigger and cleaner. So they choose to use me, which is pretty cool. And the nurse asked her recently what Rich has been doing because his wound has gotten so much better, which was really cool to hear too, because I wish Rich could get in more. And if he were able to get in more, his wound would be doing a lot better as well right now too. Just the once a week, like I said, it's going to help, but the more you can get in, the better. Jared, he came in for specifically exercise recovery, really awesome athlete in Breckenridge, and he was doing the Breck Epic and used it every single evening after his race that day for that entire week, and ended up getting first in his age category, which is pretty cool. He said that every day when he started up his ride again, he felt refreshed and that he didn't even ride the day before. So I wouldn't call it cheating, but close to. Diana, she came in with really intensive PTSD. Diana struggled with a lot of childhood abuse, and she's now about 45 years old. And for her entire life has struggled with being able to function as a normal person in society. And she has such intense PTSD that she psychologically, the damage and the changes that happened in the brain were pretty permanent, and she can't physically feel a whole lot and emotionally can't feel a whole lot either. And she started using the chamber in conjunction with ketamine infusions that she was getting. And with the two of them combined, she just came ecstatic with me and in tears always, every single session, tears of like, I can feel again, which was also a goosebump moment as well. So next, all right, contraindications and risks and things for medically to be aware of. So really the only contraindication for these mild 1.3 chambers is pneumothorax or a pneumothorax within the last 6 months. Just unsafe, the damage to the lungs. And then another one is the use of any of these medications, which are specific for chemotherapy and alcohol abuse. So with that being said, there are some conditions that I like for people to get cleared off specifically for that doctor that is treating them with that condition. So that is going to be heart conditions, lung conditions, sinus condition, inner ear condition, epilepsy, history of seizures, an autoimmune condition, TBI, concussion, stroke, or cancer or history of cancer, or pregnant. The cancer and pregnancy ones are two that honestly have just not been studied enough. Some studies say that the oxygen can help with the cancer and help kind of kill off those cancer cells. And other studies say that it exacerbates the cancer. Pregnancy, people say, yeah, some studies say that it's super safe, especially these 1.3 chambers. But again, there's not enough studies on these 1.3 chambers for me to be like, oh, you're pregnant? Yeah, let's get you in. I feel good with that. So want those people to be checked off with their doctor as well. Conditions to be aware of: high blood pressure, cataracts, claustrophobia, anyone with a current cold or allergy symptoms, someone with diabetes, or someone with pretty intense anxiety. So the blood pressure, while in the chamber, your blood pressure will temporarily increase a couple points. So people with high blood pressure should just be aware of that. Going up in there, they might feel their heart rate increase for a second, or just feel, I had a doctor just in recently actually, and he said that he could feel his blood pressure increasing. It usually just increases for a couple minutes and then will decrease back down again. And then as soon as you get out of the chamber, it will decrease as well. Cataracts, same, specifically are going to be at the deeper chamber level as well, with that high blood pressure as well. But cataracts can actually get a little bit worse for the time that you're in the chamber, and then for like up to a day after being outside of the chamber as well. There have been no reports of anyone having this with the 1.3 mile chambers. Claustrophobia, it is a small little chamber. So I've had a lot of people that have claustrophobia and nobody has had any issues with it. Once it does blow up to its full pressure, it's actually pretty roomy in there. You do have the window on there. There's a fan inside. There's constant airflow at all times too. And I'm very much in constant communication as well while in there, and can be in more conversation if that person chooses to. Everything is double zipper and double valved as well. So if you like, I can operate it from being inside by myself. So I give that information to people as well who struggle with claustrophobia, as a way for them to know if something did happen to me as the operator, they could still get out by themselves. They're not going to be trapped in there forever. So, and then cold and allergy symptoms, that is specifically just for clearing the ears. It can be pretty painful / unattainable to do if you have pretty intensive sinus issues or currently have a cold and are just really congested. It can be pretty hard to clear the ears / painful. And also just, yeah, not the best to be in there if you're sick anyway. Diabetes, oxygen actually metabolizes glucose. So while you're in there, that oxygen is literally eating up your glucose. And so people with diabetes, I recommend them bring in a little bit of a snack. I have one diabetic client that would bring in a little pouch of apple juice, that applesauce. And she would eat that applesauce like halfway through if she felt her blood sugar changing. So recommend that. And then anxiety, people just need to tell me mostly if they have anxiety, and that goes hand in hand with the claustrophobia as well. Risks are going to be pretty minor, but the barotrauma to the ear, so pain or the ear damage to the tympanic membrane. So pretty rare. I've never had anyone that has any lasting pain afterwards. The only pain they have is actually getting to pressure, and then we release that pressure, let them clear, and then they don't have any pain for the remainder of it. So it is a risk though to just kind of have some lasting pain for a day or two afterwards. Same with sinus pain. People, specifically if they have a sinus infection going on, might get some sinus pressure, and therefore creating some pain in their forehead, nose, eyes area. Pulmonary hyperexpansion. This is super rare as well at these lower pressure chambers, but overinflation of the lungs. And so really people just need to not hold their breath during decompression, and they're not going to have to worry about this. So just tell everyone to breathe normally, and yeah, don't be trying to hold your breath or do anything different than you normally would be doing. All right, so medical director. So my chamber, this 1.3 chamber, is still considered a class 2 medical device. So I have a medical director on staff that works with me, and she does all of my medical checkoffs where a client can't get their own doctor to do the checkoff for them. So going back to the other slide, I said certain conditions I want their doctor to be checking them off for. That's kind of what I meant by this. So somebody with a heart condition, I want them to be talking to their cardiologist and getting a sign off from them. Lena Wishemeyer owns Breckenridge Chiropractor and Wellness in Breckenridge. Awesome chiropractor, wonderful person. Highly recommend her for chiropractic, anyone looking. But she is more so my go-to checkoff for someone that has completed my intake form. We can see their medical history, and there's nothing of concern basically. So she does my medical checkoff for just your average client that wants to try out the hyperbaric, or use it for some condition they're healing from, but is not a very intensive medical condition. So with that being said, I do have a client referral form on my website that is easy access for doctors to fill out. Doctors or chiropractics are the ones that can refer people to me, which is strange. I don't know how they came up with that, but that is the Colorado law for hyperbaric, is a doctor or chiropractor to refer clients. So only thing doctor needs to do is click on my link, go to my website, and then the upper right-hand corner, it says refer a client, and just fill that out and it'll go to me. And it doesn't have to be like an actual prescription, which finally just clarified with the Hyperbaric Chamber Convention Center people, but they said it only needs to be a referral. It doesn't need to be prescription. So, all right, and then COVID protocols, super safe as far as COVID goes. The sheet and pillowcase gets changed in between every client. There's an air filtration system within the office as well. And everyone gets their own oxygen cannula that I keep here at the office for them if they come back for future visits. Everything gets sanitized, and I use an ozone filtration system inside of the chamber in between each client, which just kills all bacteria and viruses in the matter of about 10 minutes, which pretty cool little system if anyone's interested in ozone. And then it's also safe by the fact that it's only one client per visit, and everyone is wearing masks as well. So that's about it. Any questions from anyone? And thank you for listening. Appreciate it.
Carly, are you okay with me sharing your presentation?
Yes, please go for it.
Okay, because then I'll send it to, you know, the whole group and doctors and all that too.
Yeah, awesome. Thank you, Melissa.
Cool.
I know it was a lot of information, so, and I'm sorry, I haven't been looking at the chats. Get out of here.
So Carly, I just appreciate your time to like talk about the research, talk about the protocols, because it is a barrier that, you know, the doctors have to be the ones prescribing, but we just thought that if we can empower clients and consumers to talk to their doctors about it, about hyperbaric, I think that's always a nice way to go. Hyperbaric has not been a regular part of my treatment, but it's just because I just didn't know like what the current research was. And I think a lot of doctors, they might have heard of it, but then may have relied on some of older research. So this is really nice. So thank you.
Totally. Yeah. Yeah. And that's absolutely the case. As you know, hyperbaric has really been used for those specific conditions that are the FDA approved ones in hospital settings and not really explored in other places. And so doctors don't learn about it. And it's used as more of these off-label treatments in smaller clinics. So yeah, definitely. All right. Any questions from anyone else?
Another question, Carly, did you ever look into, so, you know, with these for everyone, you know, it's an expense that if it's not covered by insurance, I was just trying to think of what are other ways that allow people to either save for it. Were you able to look at if this was covered by health savings account?
Yeah, absolutely. So people can use their health savings account with it. So that was something I got cleared up, which is great. I had someone use it just the other day, which was really awesome. But yeah, no other insurance coverage will be accepted with it. I have had a client try to bill her insurance company, and she's very persistent. I think she's still working on it. It's been a couple months, so we'll see what comes of it. But I am also very open to working with people and what they can afford. So I work with a sliding scale model. You can pay per session. You can pay a payment plan, whatever it works. I just want to get people in and help them start feeling better. So.
I
And
have a question.
yeah,
So I'm a person that lives with chronic gout, and when I say chronic gout, I mean chronic gout. Most people who see me, they're just like, "Oh my God, how are you alive?" You know. And I was hearing that if this chamber would kind of help with inflammation and pain wise, how well do you think that would work for me? Because I also have wounds, open wounds, and I deal pretty well with my pain, but they always try to give me opioids when I'm like, no, I don't want to become this statistic of, oh, he's now an addict because we gave him this.
mhm.
And I always look for different ways to get my pain and inflammation and everything under control, but I've never been able to find anything. So I was wondering how you think this treatment might be able to help me.
Yeah, absolutely. So I have had one client that reported lesser symptoms for their gout. They were not actually using it for their gout, but found it interesting. They're like, "Oh, my gout hasn't been as inflamed as it normally is," and I was like, "Yeah, makes sense." So absolutely, the first thing that this chamber is going to do when people get in there is decrease all inflammation in the body. Um, so it's one of those things that I can't tell you it's going to cure your gout, but it will definitely help with symptoms.
Awesome. Thank you so much.
Yeah.
Carly, for wounds, how early do you have people come in?
So I've used it now for 3 people with wounds, and one of them was a radiation wound. He came in and was using it probably about, I'd say 2 months after his wound really started to get pretty bad. And he started using it. He was actually approved for insurance coverage on a deeper chamber, which was what I recommended them do. But the sooner the better, any wound. If you can get in here, yeah, as soon as we can get that healing process started, the better.
Anyone else, thoughts or questions?
Just a quick thought. I did a lot of hyperbaric for my TBI recovery, and I did find that the smaller chamber, or the mild, as you were calling it, it was really exhausting for me. And maybe that's just a TBI thing. I don't know, but I definitely couldn't ever drive myself home
Mm.
from it, just because it was really like it would really tax me out.
Mm-hmm. And Christina, how, if you don't mind me asking, how far out of your TBI were you using it, and how often?
I think it was every week to 2 weeks, and between 1 month out to 6 months out.
Okay.
I ended up transitioning to the full chamber up in Basalt.
And with the deeper chamber, you didn't get tired afterwards?
Yeah. I think it was a noise issue though. Even with earplugs, the smaller chamber was just a lot of kind of noise exposure.
Mm-hmm. Yeah, that makes sense.
It wasn't like prohibitive, but it was like, I wouldn't want people to think that was uncommon.
Mm-hmm. Yeah, absolutely. No, thank you for that. I had a client use it for concussion. She had probably up to like 15 concussions, she said, and had her last one about a week before she came into me. And I had told her it was probably a little bit too soon to get in there. And so she did a first session, and same thing, got pretty aggravated in her symptoms. And so I recommended she wait a couple months and we try it again. So that's going to be the protocol there for that. But I have found that if people use it a little bit further out, or from their brain injury and their concussion, that it is better because the symptoms aren't as aggravated then. It's not as fresh.
That's great to know. And how far out have you tried it?
I told her to wait about 3 months. Yeah.
Thanks.
Yeah.
Well, Carly, thank you so much. And, we can share with everyone your contact too. So if they have questions or thoughts after this presentation, then they can contact you too.
Melissa,
Awesome.
Yes.
will
Hi.
this recording be available?
Yes, I'm trying. We've been recording everyone, and I'm getting hold up with Censura to convert it and post it somewhere. But yes, I hope to post all these recordings that we've had the few months.
Great, thanks.
Thank you.
Awesome. All right. Well, thank you, everyone. If no one else has any additional questions.
Thank you so much.
Thank you. This has been one of the best meetings I've been going to.
Yay.
Carly, are you able to unrecord?
Yes. Stop.